Hello, I'm Corral Lozano Romero, and I, along with my other group members, Ty Brown, Valeria Fedorova, and Catherine Quintero, did our capstone project on the Preschool Language Scales 5th edition, Spanish edition. So what we already knew about the assessment was that it was a language assessment and that it could be used to assess both monolingual Spanish speakers as well as bilingual English Spanish speakers. We wanted to know the validity and reliability of the assessment because, as always, these are two components that we should always be taking into consideration when choosing a standardized assessment. And we also wanted to know what made the assessment useful, as well as what we should be wary of when using the assessment. What we learned was that this assessment looks at language as a whole, and that it has high reliability but not so great validity. And that the results can be should be interpreted with caution, although this test was designed using a sample of monolingual and bilingual Spanish speakers. Okay, so a summary of the assessment. So again, the PLS 5 Spanish edition is a standardized test, and it's used to identify a language delay or disorder in children who are monolingual Spanish speakers or bilingual Spanish-English speakers. It's appropriate to be used for those who fall developmentally between the ages of birth to 7 years, 11 months. And it includes two main subtests, the auditory comprehension subtest and the expressive communication subtest. In addition, it does have the language sample checklist, as well as an articulation screener and a home questionnaire. And the normative sample primarily included Central America, South America, Mexico, Puerto Rico, Cuba, and the Dominican Republic. But the thing with this normative sample also is that only some age ranges were included from Cuba and Dominican Republic. So there is that. As far as the administration, so instructions are located in the administration manual in both English and Spanish. And then, so for the Spanish-speaking monolingual, you want to administer every test item in Spanish, and then for those who are bilingual in Spanish and English, you want to administer the test items in Spanish first and then in English. I'm sorry. So that was for administration, and then for the language, so in what language it needs to be administered, you want to administer every test item, like I said, in Spanish for Spanish speakers, and then in Spanish first, and then in English for those who are bilingual in Spanish and English. Materials, so from birth to 2 years, you want to do more of an observation of the communicative attempts with both the parent and clinician, and then for those who are 2 years old and up, you want to also include the manipulatives. Qualifications, so the SLP must have near native proficiency of Spanish, and if they don't, they should be collaborating with another assessment professional or an interpreter. And of course, taking into consideration that if you use an interpreter, you need to have to brief, do the interaction, the assessment, and then debrief. As far as scoring goes, so the assessment does yield scores for the auditory comprehension, the expressive communication, and the total language communication portions, and it yields standard scores, percentile ranks, and age equivalents. The way that they for this test is through the dual language approach, and I'll talk a little more about that in the subsequent slides. And then they also have criterion reference scores for the articulation screener. So a norm reference score of the total language component can be calculated. They have 3-month intervals for those who fall between the birth to 11-month age range, and then those who fall between the 1 year to 7 years, 11 months age range, there's 6-month intervals. And then growth scale values can be calculated to monitor progress over multiple test administrators. Okay, so interpretation of scores, there is an item analysis checklist, and this checklist shows you items on both the auditory comprehension and expressive communication skills by developmental levels. And so this allows you to scan for errors and to determine if there's a pattern of errors existent within each age level. So I thought that was very convenient. Then it also has a Spanish profile, and this provides you with an illustration of the child's language skills, and it can compare the expressive to the receptive skills. And so some of these skills include things like vocabulary, concepts, so both qualitative and spatial concepts, time sequencing, syntax if the child is older, and emergent literacy as well. And then it includes a clinician's worksheet. So this is used to summarize the information about the child's language ability and to prepare them for, or to prepare the clinician for program planning during IEP meetings. Okay. Okay, so usefulness of the test for English learners. So there are a couple strengths. So the first thing that I noticed was that, or one of the first things that I noticed, was that there's notes within the actual protocol on items that language variations may be existent in, so that the child isn't being penalized for aspects of normal language variation. So one example that was found was in item 31 of the expressive communication scale. And so this particular item uses plurals. So stated was, do not penalize for language variations, such as consistent aspiration of the sound in the protocol, to ensure that children are not penalized for aspects of normal language variation. So these little notes are nice for the clinician to have as they're testing, and of course they're nice to have been looked over prior to testing so that we can be keeping that in mind. And then another strength was that it's a test that can be administered in both Spanish and English, and then it's also administered within a reasonable time. So if it's only administered in Spanish, it's said to take between 20 and 45 minutes, and if it's a dual language administration, it's said to take between 20 and 65 minutes. But of course you have to take the child's age into consideration and the behavioral components that go into that. But also the manner that it's administered, it's more of a play-based assessment, and it has, these fun manipulatives, the little bear and the cars, and so it kind of takes some of that stress and some of that, I guess you can say, contextualized environment from the test, and it allows the child to be administered or tested in a more natural environment. And so then weaknesses. So English learners may be falsely identified as having language disorders. Why? Well, the specificity of the assessment was said to be 0.88, which in our field, according to Plant and Vance in 1994, is considered to be fair. But when you're really looking at it, this means that 12 out of 100 typically developing children will be identified as having a language disorder, and thus may be unnecessarily referred for special education services. So there's that. And then also, not included on the slides, but the sensitivity was said to be 0.85, which again is fair within our field. But this means that 15 out of 100 children who truly do have a language disorder will not be identified as having one through the PLS-5 Spanish edition, and therefore they will not be receiving things like extra academic support and extra language support that may very well be necessary for them to succeed in the academic setting. And then also, it was talked about already, but validity was considered insufficient across a couple types of validity. So we talked about specificity, sensitivity and specificity, but also things like concurrent validity. So this was a little interesting to me. So one of the tests that the PLS-5 Spanish edition was compared to was the PLS-4 Spanish edition. And right there, one of the things that was mentioned was that we need to take into consideration the psychometric values of the test that we're comparing our current test to. And so the PLS-4 Spanish, its auditory comprehension, the specificity was said to be 0.56. Its expressive communication specificity was 0.69, and then the total language specificity was said to be 0.63. So that right there, it had low specificity. So, and now we're making we're comparing our PLS-5 to this PLS-4. And either way, when they were compared, the correlation coefficients were said to be 0.69 for auditory comprehension, 0.71 for expressive communication, and then 0.81 for total language. And then also the PLS-4 Spanish, it was used and aged at birth through 6 years, 11 months. This means it doesn't cover the entire age range of the PLS-5 Spanish edition, which covers birth to 7 years, 11 months. So there's also that. Also, another weakness was that it's invalid for populations of children with attention deficit disorders or motor or sensory impairments. And another thing we want to consider is the fact that the normative sample was matched to the 2008 U.S. Census population, and so of course this would reflect the population characteristics of the 2008 U.S. Census, but that's been almost 10 years ago, and the demographics, as we are well aware of, have changed pretty significantly since. So there's that to take into consideration. As far as evidence-based support, so I've talked about it already, but the PLS-5 Spanish edition, it is a dual language approach. So what this means, and before I talk about that, Kester and Peng in 2002 did find out that it was a more valid representation of the bilingual child's language abilities. So there's that. And then, and also what that means is that both of the languages, both the Spanish and English, is being taken into consideration and given credit for. So we're not testing the proficiency of the child in either language. What we're testing is the language itself. Because the goal of the PLS-5 Spanish was to assess a child's communication skills and the understanding of the language concepts by making comparisons as to what is age appropriate. Because knowledge of these age-appropriate concepts can be more representative of a child's typical language development, despite the language being used, because again, we're not testing for language proficiency. And one of the very interesting things that I actually found out through my, I guess, reading of these articles was, and this was shown by 2 studies, one by Jackson Maldonado in 2003, and then there was another study by Pena et al. In 2002. So both of these studies found or discovered that only 30% of concepts are represented in both languages of young bilinguals. Meanwhile, the other majority, the 70%, are being represented in one language or the other, but not both. So again, these 2 studies and the discoveries of these 2 studies support the reason as to why dual language assessment is a much more valid approach to assessing these bilingual children. So consequently, when scoring a bilingual child's assessment of their language abilities, it's necessary, like I mentioned, to give credit for both, for skills exhibited in either language. And obviously, we don't want to duplicate the credit for skills exhibited in both languages. But so this type of administration and scoring will reduce the risk of underestimating a child's knowledge of language as well as overestimating their language. And this was shown by Kester and Pena in 2002. So this in turn will reduce the risk of diagnosing a child acquiring a second language with a language disorder such as a specific language impairment. An impairment that has been shown, to share characteristics of English language learners. This was shown by an article or a study done by Paradis in 2005. So, yeah. And then we have our references. Okay, and so thank you for listening to this presentation.